Hi guys, good afternoon. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy, creator and founder of Balance and Fall Support Group and Physiogen PT and Wellness. So again, we have amazing, thanks God it's Thursday. Every Thursday, guys, wherever you are listening right now, we always interviewed physical therapist, innovator, entrepreneur. And I just want to say hi if you're in Philippines. Mabuhay. And if you're in United Arab Emirates and Qatar, Salam Alaikum, everyone in Malaysia as well. And in Canada and also in US, good evening to all. So wonderful. Thanks God it's Thursday. For tonight, we're going to introduce and interview one of our physical therapists, Dr. Physical Therapist, and a board certified clinical specialist in geriatrics physical therapy. She has 29 years, 25 plus years as a physical therapist. Currently, she's working in subacute rehab and also in home health. And that's really an amazing setting. But on top of that, she's also faculty in the laboratory of the not United, in University of St. Augustine for Health and Sciences. Amazing. She is one of the laboratory faculty there in geriatrics and also in differential diagnosis. On top of that, she also have position in Academy of Physical Therapy Association in the nominating committee and also in the webinars and also another great achievement in Florida Physical Therapy Association with Dr. RV and what great physical therapists back there in Florida. They always have amazing webinars, and she is the chair of the Geriatric Physical Therapies in Florida PT Association. So that's great achievements. So we would like to know how she managed her time. And she's a mother of three awesome, handsome gentleman. All right, so she can manage all of those, and she's a great spiritual, very good belief with God. And so now let's get to know with Dr. Minnie Rafael. Welcome, Dr. Minnie.
Thank you so much. Hello, everyone. Glad I was invited by Dr. Jenny. This is a privilege. That's what I told her, to be able to speak about what I do and what we all can do as physical therapists, right?
Yes. Thank you so much. I'm so grateful for this opportunity, Dr. Minnie. So how do you want me to call you throughout the interview, Dr. Minnie?
You please may call me Minnie, which is what I tell my patients.
All
Call me
right.
Minnie. Yes.
All right. So, Minnie, those are great achievements with those 29 or 20 plus years of a physical therapist. And I see all your volunteers in the
You
leadership
can say
role.
29 because I graduated
Exactly,
in
yeah. 29 years.
proudly 29. I graduated when I was 13 or something. No,
Oh, wow.
no, I'm
Wow.
teasing.
So I think in University of Philippines, right, Minnie?
Yes, so I graduated
Okay.
in the University of the Philippines, Manila. And
Mhm.
during that time, we were heavily recruited. So I stayed for a year. I actually helped in community-based physical therapy. It's called SUCOB Incorporated, which was an NGO. It was fun. And I took students then. And I came here to the United States and I still kept taking students. I'm also a certified um, clinical instructor. That's one of my classes.
Yes. All right. Those are really great achievements. I am so proud that I know Minnie. We met in Facebook. We have common friends. We have great mentors, and we are also certified exercise expert in aging adults. We forgot about that. And then we are volunteers in Academy of Physical Therapy Association in geriatrics. So we are really enjoying. But let's get to know more on her with her 29 years of physical therapy. What are her wins and challenges that she remembers in our in geriatric field, or of course overall as a physical therapist?
I think what's initially difficult, I'd have to say, like the practice of geriatric physical therapy is not as popular as neurologic physical therapy or orthopedic physical therapy. So it's really a niche, and I've I've worked everywhere else. I've also had previous experience. So I've been with the geriatric population for about 15 years. But
Mm.
before that, I worked in the hospital. I did contract work. So we kind of did everything with everyone. And I found that a lot of people didn't seem to invest much. I started hearing things like, oh, when you work in a nursing home, that's just nothing work. You just move their legs 10 times, things like that. So there's a little bit of a looking down on the practice of geriatric physical therapy. And that became a challenge to me because I've seen patients get better, and I've seen, people in their 80s thrive. And I've seen people still work. I've worked with a lawyer that went back to practice at the age of 80. I got to meet the person. He was a dean, or anyways, he was high up in education, and he created the magnet programs, in Florida. And to me, to see them thrive and go back in the community is an achievement, because these people have contributed to what we're reaping now. I mean, these are the generation that make America what it is, a safe place to live, where it's still better than most of the rest of the world. So, that became one of my impetus, to show people that, listen, this is not the end game. Working with the elderly is actually as satisfying and productive in the community. Mm.
Nice. Yeah, it's really great reminder to, especially to our new therapists right now.
Mhm.
And
Mhm.
then especially, what will be your tips for people or clinicians looking for a niche, what they wanted, especially certification as well. Is it OCS? Is it geriatric for me? Is it neuro for me? How can you help for them to decide in some ways?
I think you have to find what gives you satisfaction. It is the goal of the certification is to make sure you're excelling where you're at. That way, you're not practicing a non-evidence practice, or you're not doing your clients disservice, or underdosing them maybe, or not providing the care that they need. So I think that's the first rule, is you have to see what makes you happy after you work. When you go home from work, do you feel that you're satisfied, that you've contributed to someone's well-being, or you've helped them progress. And I just met someone that does pelvic health, and that is truly a niche. And I'm glad for people like her. She was one of my last interns, but she knew what she was going to be. And I'm grateful for her. I told her, listen, I'm going to be 50 soon, and I might be calling you in like 10, 20 years, if I have. So
Issues with pelvic
yeah.
issues,
Yes,
or
yes.
incontinence,
Yeah,
and also
exactly. Yeah.
postpartum
Yeah.
issues, that's really
Yeah.
good. It's a women's, more on women's
Yeah.
wellness.
Yes.
Yeah, and also lymphedema therapy, that's
Hmm.
another niche
That's another
there.
niche. Yeah.
We highlight that too. And also that's really demanding to the pelvic. Yeah, so you said something already about the evidence-based practice. Can you tell us the great resources and who are your mentors that help you a lot in this geriatric world, so that people can access? Our listeners are clinicians and also new clinicians, and also we have some caregivers and therapists there. So what do you give us some tips on what they need to focus on?
Okay. So what I can say is, what led me to evidence based is my certification. So when you certify, you study, and you make sure what you know is what's applicable, and what's verifiable or evidence based. And so that's kind of, so I took my GCS about 10 years ago. I'm actually up for renewal, but um so that was kind of my journey. I realized that your confidence as a clinician grows as you understand evidence space. So my sources are, I've always been a member, and I credit my old employer called River Garden Hebrew Home in Jacksonville. I worked with them for 8 years, but that facility really, because it was there were 403B, they were non-government, what do you call that? They were not for
Like not
profit, yeah,
profit.
yeah,
Okay, okay.
company. So they really highlighted our expertise more than productivity, and they were the ones that paid for my my certification as a exercise expert for aging adult. They supported my desire to become a geriatric certified specialist. And so those were the ways, and we made sure our practices, inter-rater and intra-rater practices, was consistent among therapists. So they really held the bar, and that's how I learned. So my sources are, since we've always been a member of APTA. APTA, of course, is my prime source. But for people that are like in the Philippines, there's several resources that I think you can access, like rehab measures, which is like the Shirley Ryan Ability Lab. They are very, they update their data, and you can get like evidence-based outcome measures, and you can even from their references pull out information. It also helped when I went to transitional doctorate, because of course those classes make you pull out how to read articles. So I've learned how to look at Google NIH articles or the NCBI. So those are my resources, and I make sure that I'm up to date. Like I know that the APTA is coming up with clinical practice guidelines, and they try to make that available in public. Another source for the elderly is, of course, CDC and the NIH, of course, as well. They have their online resources. If you just take your time, they have so much, even like resources to give to patients, like exercises and how to do certain outcome measures. So those are kind of my go-to places.
Oh,
And of course,
wow.
APTA geriatrics.
Yes, APTA
Yeah.
geriatrics,
Thank you,
and also
Dr.
you said,
Thank
go
you
ahead.
to Dr. Rolando Lazaro. He's one of the people that created that platform, I believe. And so it's been a great thing to have that.
Yeah. How to access that part? The one that in the webinar, APTA geriatrics.
So you have to be a member of the section to actually,
Yes.
no, you don't have to be a member. I apologize. So
Okay.
the APTA webinars, if you just go to APTA Geriatrics Online,
Okay.
you can pull out on the tab webinars. And if you're a non-member, it is at a higher cost. You just have to pay a higher cost. For members, it's a discounted course.
Do they need to be APTA itself?
No,
Or
actually,
okay, so
well,
that's the one,
yeah,
the non-member, not
yeah,
the
exactly,
section.
yeah. So normally they're like, like it is, like $50, but those
Yeah.
are like, verifiable speakers, and they're well vetted um,
Mm-hmm.
sources. Like this coming June 16, I'm gonna plug. I don't know if you've heard of Jackie Osborne.
Yes,
She's the
yes.
geriatric, head at Jacksonville. It's funny, we met professionally because we actually contracted at Brooks Rehab. And we met then, and then she became president, and we connected through the FPTA geriatric special interest group. And now I got to invite her to speak. So she's going to talk about exercise prescription for the aging adults, to make sure that we are prescribing the appropriate dosage of exercise to the right diagnosis. And that's going to be on June 16th.
Wow.
That webinar
That's a great
at
topic. Mm-hmm.
30, I believe. Yeah. So I'm excited
That's
for
really,
that. And I'm
yeah, that's
moderating
really
that.
good.
So
Oh, so only
yeah.
her, but it's like that's really good
Well,
for
Jackie
other.
will be the speaker, but I'll just be introducing and checking
Okay,
people's
gotcha.
questions. Yeah.
That's really good. That's even the topic
Yeah.
itself. So I'm sure
Uh-huh.
lots of our clinicians will be interested to learn more about that. And then
Yeah. Maybe I can
lots of
share
people, yeah, lots of people also didn't know, and I'm not familiar maybe with the national age senior games
senior
that we just
games. Yeah.
had. So it was in Florida, and you're one of the volunteers with Becca Georgie.
Mm-hmm.
So, and we also have the save for the it is a fitness exam. So senior athlete fitness exam. So can you tell us more the highlights in the National Athletic Senior Games recently in Florida? So
Okay, so
congratulations also
thank
for
you.
being
That
part of that.
we were hosting it. So, Becca
Mm-hmm.
Georgie is actually from Dakota, South Dakota. So she's
Okay.
actually from
Yeah.
South
Mm-hmm.
Dakota, but she's
Mm-hmm.
been doing this research for senior athletes. So that's really what the name. So the name of the test or the toolkit is SAFE. So it's the
Yes.
Senior
Mm-hmm.
Athlete Fitness Exam, and it's a great way to screen seniors who are very athletic. And she's been doing it for 6 years, I believe, or more. She's been following these athletes, so she's collecting all the data, and I think that's really great in terms of information and the validity. Given that it'll be like hundreds or thousands even of participants. So there are different tests that she does, like sit to stands, things, again, outcome measures that are evidence based, that that it has reliable indications for falls or and different things. And she measures BMI and different, as well as standing balance, single leg standing balance. Stance time on foam with eyes closed. So it's a very challenging task, but the goal of that is to just help these athletes stay active and safe. And the nice thing about that experience is you'll be impressed at how athletic these athletes are. And that's really, we brought students on. I have an intern, and we invited some schools, of course, to participate. And it's amazing to see these younger future PTs appreciate how active and how athletic someone in their 80s. There was 100-year-old lady that won
Wow.
her 50-meter dash. She was,
Wow.
I didn't
Mm-hmm.
get to see if she was the only athlete at that age group, or there were a couple of them, but anyway, she won gold. So
That's great.
those are things that we celebrate, and that's what the National Senior Games is. And I really appreciate Dr. Becca Georgie, and she has her partner now that's helping her actively, that created some exercises. Oh, and part of the screen is like, we're
Mm-hmm.
also screening the range of motion, as they age, the vestibular hypofunction, which is the single leg stands on foam, or eyes closed. But the good thing about that is we get to educate them as well, and
Mm-hmm.
get them aware of how to keep doing the sport so that they can stay active and safe doing their sports. So it was a great
That's really
experience, for 10 days, but I volunteered
10
for
days.
just a day
Wow.
and a half. Yeah,
That's really
yeah.
good. Yeah, I
Yeah.
even told to Dr. Becca. So Dr. Becca Georgie is one of our global
Mm-hmm.
health in
Yes, yes.
aging adults. She's the secretary. And then so she told me about that. So that's why I said you will meet Minnie. And then when I heard that you will be volunteering also, and you're the host on that in Florida. So that's really amazing. So you have great one and wonderful pictures you provided for us. So thank you so much. You keep posting those great pictures with the different and so check out guys with the Florida Physical Therapy Association page. Also, it's there. And also
Yeah.
we shared also in Balance and Fall Support Group. We have different participants and check out also we will provide the link for the SAFE for the senior athlete fitness exam. So it is Becca, Dr. Becca is the
Creator.
researcher and the
Yes.
creator of
Mm-hmm.
that safe exam, and that's really good. She made, I think she will going to partner with APTA, so it's easy to access for all of you. So that's good to know that we have this wonderful research and creation. So thank you so much, Dr. Mini. So how can they going to, if they want to improve more, I think we have also MedBridge as one of your resources,
True.
right?
Yes. Yes.
Yes,
Yeah. I forgot
yes.
about
So
MedBridge. So MedBridge
yeah,
is another one. Yeah.
so you're going to host and I mean moderating this coming June, but you also have upcoming webinars. So tell us more about that.
Yes. So the webinar is on May 31st. I think by this time it would have passed, but it's on May 31st. I was going to
Mhm.
talk about um, COVID-19 encephalopathy among the
Mm.
elderly, and it's a case study. So it's through the FPTA Geriatric Special Interest Group. We try to give seminars once a month or at least every quarter. Online. We try to post it on, again, the FPTA website. So on top of the APTA, there's national level webinars, and then there's local level webinars, and that's what it is. It's our service to our state, the physical therapists and students, to help them become more aware of how, my interventions or the general interventions with specific cases work. Like Dr. Vicente, a good friend of mine, actually gave the last
Yes.
one, and he discussed differential diagnosis of NPH, normal partial hydrocephalus, and Parkinson. So this time I'm talking about delirium versus dementia, and or the
Yes,
combination, and
that's
their
really good.
response
Yeah,
treatment. Yeah.
those are really good topic. Especially I remember when we hosted and in the Pampanga, the for Dr. Vitente, that's his
Mhm,
alma mater. So we talk about the dementia there, and then he
mhm.
talk about the hydrocephalus that you'll never know exactly. Sometimes the doctor really need to diagnose, but those are the differential diagnoses of those. So those are
Yeah.
great topics, especially if you're gearing to know more about what is dementia
Yeah.
and also those things. Go ahead,
And if I
Dr.
if I
Me.
can just add, again, it's
Mm-hmm.
so easy for us to tack a patient's cognitive decline or deficits with dementia. Like my case is an 80-year-old patient that had COVID encephalopathy. So his brain got inflamed. He had
Mm-hmm.
mild cognitive dementia. He lived with his family. She did. She had mild cognitive dementia, lived with her family. However, the doctor just kind of just tacked her. I mean, it's a good thing she was diagnosed with encephalopathy, which indicates that the cognitive deficits or these limitations you're seeing could possibly temporary. And that's the emphasis, that sometimes we see dementia and we just assume, oh, that's how they are, which is not true. And as this patient has shown, only hers took a good bit. So she kind of had the long haul type of COVID, and it took her months instead of our regular timeline. Again, which the message goes, we can't just easily give up on these elderly. Otherwise, she would have fallen in that slippery slope of frailty if people just left her in bed and said, oh, that's her new level. She had COVID, she's 80, she's old, even though she was walking a month ago. Oh, let's just give up on her. It's a good thing our facility has a restorative program, and she has family members, and thank God, you know more than 6 months later, she's up and walking again. So these are cases that I'm proud of, that I was part of seeing that happen and not let that patient fall into just being bedbound and decline progressively from there.
Yes, exactly. That's a great point because we met some metabolic encephalopathy,
Mm-hmm.
and then these are now a little bit more common that because I am home health and that's their
Diagnosis.
diagnosis. So that's a good point. And then also the May is mental health awareness month.
Mm-hmm.
So depression, dementia, and those are really has the highest link. And then now encephalopathy is a brain disorder. So everything we need to know, check out that it will be on May. So maybe some of you already watch it when you watch this. So thank you so much. And then connect always with the FPTA, Dr. Vitente, Dr. Minnie, and the rest of the Florida PT organizations. They're so active in delivering. Also, I would like to say kudos to Dr. Amy and Lady Bautista.
Yes.
So they are all there in Florida. Those are really wonderful educators in University of St. Augustine for health sciences. So what are your tips for our clinicians here, Dr. Aramini? So for the balance and fall support group, we have clinicians for physical therapy or occupational therapy. What will be your best tip for their exercise? And also what will be your tips for our clients and caregivers listening to us? Just to
Yes.
close.
So yeah, one of the things that kind of was highlighted through the SAFE or the National Senior Games, the SAFE protocol was the standing, single leg standing with eyes closed. Of course, it's hard enough. So make sure that if you have a caregiver or family, if you're a caregiver or family member is elderly, you have them close their eyes and stand on narrow base to just enhance their vestibular function and just kind of determine how dependent they are on their vision, with their standing balance. You'll be surprised. And ways to enhance that, I always tell my patients, if while you're brushing your teeth, close your eyes, and if that's too easy, then maybe try to stand on one leg. It's fairly safe because you're normally in front of a sink. So I just tell them, make sure you can lean on the sink. So these are like practical ways that I tell them. And of course, if I tell patients, if you don't have time in your retired schedule to do exercises, the single most important thing you can do is sit to stand, arms across your chest. If you can do it, start from a higher surface and then, gradually go down up to about 17 inches, which is a standard chair height. So those are the things that I normally make sure my patients are able to do. Of course, I always do timed up and go and measure it, to give them that objective measure that, hey, when you came in, you were at this level and now you're here, and there's several other tests like bird balance, dynamic gait index, etc.
Yeah. I always like to compare their before and after, right? And
Yes.
I am so
Yes.
excited to show them the numbers. And then I really like also that you say about the one leg stands. I keep informing my patient, all right, as you said, you're just putting makeup or standing, but I like to add that eyes closed, because I just ask them every time you brush your teeth or put makeup, do the one leg stands. But now I can also add some activities with the eyes closed this
Yeah.
time. And then
Yeah.
while they're brushing their, I don't know how they can brush,
You can
but they can.
brush your teeth.
Yeah.
Yeah.
And then I keep telling them that those other exercises are amazing, strengthening, quad setting, but these one lessons are so simple, but with the evidence base from, we have one, I believe, Sakamoto. He explained already, he showed in his evidence research that it's really effective for those people in the research group. So I always emphasize that. And I thank you so much for delivering us. The numbers are very important when you keep comparing them. So thank you so much. So
All
if
right.
we want to connect with you, Dr. Minnie, so how can we connect with you? Any emails or
I know.
website?
I'm only on Facebook. That's the only place I am. So if you Google Minnie Raphael, it should pop out. And that's also my email, minnie.raphael@gmail.com. So if you want to get in touch, or you can just send me a message, Facebook message.
All right. Thank you so much,
All right.
Minnie. And
Thank
that's
you,
how you
Dr.
will
Jen.
connect. You're welcome. And that's how you can connect with Minnie. And before we close this, how do you, what do you call that? What keeps you moving, so with our balance and full support group, what keeps you moving? It can be physically or emotionally and things like that, personal.
On a personal level, and I told you this earlier, my motivation is God. I always say, I work for the audience of one. So wherever I work, I know I have a boss, but I have a higher boss. And so if you look at your life as something that's God's gift to you so that you can be a blessing to others, to me, that's my motivation. I'm grateful that I have a job. I'm grateful that I have a job that helps people. And I'm grateful that I have a God that has provided me all these blessings, so that others hopefully will be blessed through me, but in turn see God, in my life. So that's
I
my
love it.
motivation.
Very nice. That should be the reason why we keep helping people. That keeps us moving. Thank you so much. That's really motivational,
Okay.
inspiring. And thank you for all your contributions to our geriatric world. And
Yes,
those are wonderful volunteers, and you're amazing to balance everything. That's a lot, right?
it is a lot. It's been a
Yes.
pleasure. I thank God for my husband who's been patient with my schedules and all these
Yeah.
meetings.
It's
But
very important to have a very supportive
yes,
spouse in everything
yes,
we
yes.
do. So thank you so much,
Right.
Minnie.
Thank
And
you, Jen.
you're welcome. And thank you so much, guys, for listening. If you want to connect with Minnie, you can contact her, and also, and we will put her email here, and also in the Florida PT Association. She is also in University of St. Augustine, and then and nominating committee in the Academy of Physical Therapy. So she's all over there, and we will connect with her. If you have any concerns, questions, or topics that you want to discuss, we will connect with them in Florida PT Association. Thank you so much, and
Yes.
thank you guys
So
for
if you're
your
from
support.
Florida
Mm-hmm.
and you have
Mm-hmm.
suggestions as a physical therapist, how we can best serve you, I am in the geriatric population, but I'm actually part of the Southeast District group as well. So just let us know and we'll try to serve you.
Yeah, it's huge, right? There's a south. I really don't
Yeah,
understand
Southeast
the Florida
District
yet.
is the
Southeast.
biggest.
Mm-hmm.
Yeah.
Oh, okay.
Miami. That's where
Because
we
I've
are.
been there. My number is even 727. So my agency back is in Castleberry. So I know Castleberry. I've been in Orlando, and then I have many
Central.
friends there.
Yeah,
Yes.
Central
So my
Florida. Yeah.
agency was there, and then they sent me here in Delaware. So that's why I'm here. All right. And my
Okay.
husband worked in Tampa before. So Florida is dear to
Right.
our heart.
Mm-hmm.
If we will not be in Delaware,
That's
most
central.
probably we will be in Florida.
That's right. Well, we'll
Yes.
welcome you here when if you come back.
Yes, thank you so much. So
All right.
guys, thank you so much and good evening. If you have any concern, it's me again, Dr. Jenny Yusuf, physical therapist and Doctor of Physical Therapy, Vice Chair of the Academy Physical Therapy Association Global Health in Aging Adult Special Interest Group, certified exercise expert in aging adults, and we are here to help you and guide you with other geriatric clinical specialists all over. And thank you so much. Bye for now, guys. Take care.
God bless.
Thank you, Dr. Minnie.